Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
This deep dive was created using generative AI tools to support accessibility and clarity. The content is grounded in the research and instructional work of Dr. Michael Jones. Okay, let's unpack this. Today, we're taking a deep dive into something absolutely essential for telemental health practitioners, especially if you're, a solo practice owner. We're talking IP, that's IPPP, and HI tech compliance, focusing specifically on administrative safeguards.
Yeah, and what's really fascinating here, I think, is how these regulations aren't just like technical hurdles to jump over. Not at all. They're actually a critical living part of your ethical responsibility. And they're fundamental to building that genuine trust with your clients. So our mission today really is to give you a clear, practical roadmap. How do you navigate these requirements? Understanding not just what you need to do, but deeply why it matters, particularly when you're wearing all those hats as a solo practitioner, right?
That's such a crucial distinction because as a solo practitioner, you really are your own HIPAA security officer. It's a huge responsibility, absolutely, but maybe also an empowering one. You're the one responsible for safeguarding electronic protected health information, or EPHI. You're leading the charge. Whether that's learning the details of HIPAA and telehealth security, carefully choosing those secure platforms, or creating straightforward procedures for protecting client information. It really does all fall on you.
And this is precisely where administrative safeguards become your, let's say, foundational blueprint. These are the required policies and procedures specifically designed to protect that EPHI. Think of them as the guardrails for your practice. And they're implemented through things like, thorough workforce training, even if that workforce is just precise access management.
Knowing exactly who sees what.
Exactly. And consistent security oversight. This isn't just about avoiding penalties, though that's important. It's an ethical obligation. It directly supports the therapeutic relationship by fostering trust and ensuring confidentiality. It fits right in with the ACA Code of Ethics, specifically ACA B.1.c, which covers records and documentation, and it also echoes the NBCC standards for adhering to legal requirements. That's NBCC 92.
Okay, so when we talk about those essential tasks a solo practitioner needs to handle, it sounds like quite a range. You need to know what to do if something goes wrong, right? How to respond quickly and effectively to an incident. And importantly, you have to stay updated on new requirements, the ever-evolving digital threats. That sounds like a job in itself. And on top of all that, you need that clear paper trail, keeping meticulous records of all your compliance activities. Speaking of records, what specific documentation should a solo practitioner absolutely keep on hand? What's the minimum?
Right, for a solo practitioner, think of this documentation as your professional safety net. It's crucial. You should absolutely have a written statement, something formal, naming yourself as the security officer for your practice. Then, a comprehensive list of all the platforms you use, your telehealth, EHR, billing systems, whatever, along with clear reasons why each one is HIPAA compliant. You need to know why. And crucially, a simple set of procedures outlining how you handle client information, from intake all the way to termination. Oh, and don't forget copies of any training certificates you've completed. That shows your commitment to ongoing learning. And finally, records of any security incidents, no matter how minor they seem, detailing how you handled them. Like you said, it's not just a checkbox exercise. It's a living, breathing part of ethical practice. It impacts client trust and proves due diligence if questions ever pop up.
That's a great point about it being a living process, not static. And that brings us neatly to a crucial element, training. This is where it gets really interesting, I think, because even if you're a solo operation, you still need to think about training, not just for potential staff way down the road, but for yourself right now. How do you even approach that self-training when you're already stretched so thin?
Right. And the core knowledge areas for self-training, they're non-negotiable, but maybe more manageable than they sound at first. First, you just need to understand the HIPAA basics. Specifically, what is protected health information? Get clear on that. Second, you have to master your platform security. Know how to use your telehealth tools safely, understand all their built-in privacy features, really dig in. Third, password security. Creating strong ones, managing them securely sounds basic, but it's critical. Fourth, you absolutely must know what counts as a breach, and, maybe more importantly, what specific actions to take if one occurs. have a plan. And finally, client verification, making sure you're talking to the right person. This ties directly into NBCC 106 for maintaining client safety and confidentiality.
Okay, so for the solo practitioner listening, we've actually got a simple training plan that breaks it down, makes it less overwhelming. So in month 1, maybe you complete an online high-pay training course. Get the fundamentals. Month 2 is dedicated to really digging in, learning your specific telehealth platform security features inside and out. Like you said, master it. In month 3, you could practice incident response procedures, maybe run through a hypothetical scenario, what if this happened? And then ongoing, it's just about maybe 30 minutes quarterly, just to review updates, new threats, keep it fresh.
That sounds very doable. Now, if you do bring on staff, maybe a virtual assistant, contractors, they also need essential training, but it's tailored to their role. They need to understand the basic HIPAA rules relevant to their specific tasks. They don't need to be HIPAA scholars, but they need boundaries. They absolutely must know how to handle scheduling and client communication securely and adhere to strict password requirements, secure login procedures for any systems they touch. Crucially, they need to know exactly what information they can and cannot access or discuss. That line needs to be crystal clear. And perhaps most importantly, who do they contact immediately if they see or suspect something suspicious? This creates a shared culture of vigilance, which is vital.
Right, and for that, there's a simple staff training checklist you can use. You need to make sure they complete a basic HIPAA training that covers their scope of work. Tailor it. Thoroughly review your practice's specific procedures with them. Have them sign robust confidentiality agreements that's non-negotiable. And don't just, tell them. Test their understanding, maybe use a few what-if scenarios to ensure they truly grasp the practical application, and always, always provide them with your direct contact info for any questions or problems they run into. Make it easy for them to raise a flag. So, we've covered the crucial groundwork, being your own security officer, training yourself. But then comes the practical challenge for any solo practice, managing who sees what. How do you control access to highly sensitive client information when you're, literally the one managing everything?
This brings us straight to the minimum necessary standard. It's a cornerstone principle from the HIPAA privacy rule. It basically mandates that covered entities, and that includes you as a solo practitioner, must limit the use, disclosure, and requests for protected health information, or PHI. Limit it to the absolute minimum necessary for the intended purpose.
Minimum necessary. Okay.
In Telemental Health, this applies to everything. Your digital communications, how you select your platforms, how data is transmitted, how you share information, all of it. For instance, if you're discussing a case with a consultant, you provide only the details essential for that consultation, not the client's entire life story. This is also strongly supported by NBCC 94, which requires electronic technology communications to maintain robust encryption and security standards. It's about being precise.
Got it. So let's break down who gets access to what in a typical solo setup. It seems pretty clear-cut, but maybe worth stating. As the practitioner, obviously, you need full access. All client information for your cases, platform administration settings, billing, scheduling, backup, security management, the works. Now, if you have a virtual assistant or some admin help...
Okay, their access is much more limited. Scheduling system access, yes, but strictly limited to appointments. Absolutely not clinical notes. They can handle basic client contact info for confirmations, maybe insurance verification if they handle your billing, but explicitly, they should not have access to clinical notes or treatment information, nor should they touch platform settings or security configurations. Keep those separate.
And what about tech support? Someone helping you fix your computer or the platform?
That's temporary access only when you are present. Ideally, use screen sharing for troubleshooting and make sure any PHI is carefully hidden or obscured before they connect. They explicitly should not have independent access to your systems or any access whatsoever to client information or files on their own. Supervised, temporary access only. And those simple access control steps are crucial here, especially when you're managing these different potential roles, even if it's just you and one VA. First, use separate accounts for everyone, including yourself if you have different roles within a platform. Never, ever share your personal login. Second, always give the minimum necessary access. Ensure people only see what they absolutely need for their job, no more. Third, review access regularly, maybe every few months. Just check in, ensure it's still appropriate, hasn't crept beyond what's necessary. Fourth, remove access immediately when someone stops working with you. Don't wait. This is non-negotiable. And finally, document everything. Keep a simple, clear list. Who has what access and when was it granted or revoked? This whole approach directly supports the ACA requirement for appropriate records management under ACA B.1.c. It's good practice all around.
Okay, that makes sense. But how do you actually keep track of who accesses what without spending all your time playing detective? Are there, like, easy ways to monitor access?
Absolutely. And thankfully, many telehealth platforms offer built-in features that make this surprisingly simple, actually. First, just turn on the activity logs in your telehealth platform and any other HIPAA compliant systems you use. Most have them. Second, review login reports monthly. Just a quick scan. Check for unusual access times or locations, like someone logging in from, I don't know, a different country at 3 a.m. That's a flag. And third, set up alerts for failed login attempts. These can be an early warning sign that someone might be trying to gain unauthorized access.
Okay, so when you're doing that monitoring, what are the big red flags to watch for? The things that should really make you sit up and pay attention?
Yeah, you're looking for anomalies, things that just don't look right. These include logins from unusual geographic locations or at really odd hours. Multiple failed login attempts on any account that's a classic sign of a brute force attack, someone trying to guess passwords. Also, be vigilant for access to client files you don't remember opening yourself. Yeah. Or changes to system settings you definitely didn't make. Or, and this is critical, any complaints or concerns raised by clients about their privacy. Those need immediate investigation, no question.
Right. Okay, so beyond access control, a really fundamental question arises. What exactly is protected health information, PHI? Why is it so important to classify it and understand its scope?
Good question. PHI is basically information that relates to a past, present, or future physical or mental health condition. It also concerns the provision of health care or payment for health care. And critically, it identifies or could reasonably be used to identify an individual. And remember, it exists in any form, electronic, paper, even just spoken words in a consultation. It's the core of what API aims to protect.
Most people listening are probably familiar with the core HIPAA identifiers, but let's highlight a few that can be particularly tricky or maybe often overlooked, especially in the telemental health space. We know there are 18 HIPAA identifiers that instantly make something PHI. Names, geographic subdivisions smaller than a state, dates like birth or death dates, phone numbers, email addresses. The obvious ones. But here's where it gets a bit surprising sometimes. Did you know even something like a web URL or an IP address can instantly make data PHI? Think about it. A client consistently logging into your telehealth portal from a very specific, maybe unique IP address. That seemingly small detail, if combined with other info, could potentially identify them.
Exactly.
It highlights why we need to be vigilant about every digital footprint. Other tricky ones include biometric identifiers like fingerprints or voice prints, and of course, full face photos.
And what's particularly important in telemental health, or what we sometimes call quasi-identifiers. These are bits of information that maybe by themselves aren't full PHI, but in the context of your practice, they can easily identify someone. Think about a calendar invite that just says Client J anxiety session. Now, Client J on its own isn't much, right? But adding anxiety session clearly points to health information. And if someone happens to know who Client J is in your practice, boom, it immediately becomes identifying information. Other examples: session recordings, video or audio that contain identifying info, content from screen sharing if you're not careful, and personal stuff is visible, chat logs if they contain identifying details, even email signatures if they clearly link back to your mental health practice, or file names containing client identifiers, all potential quasi-identifiers.
That makes perfect sense. And that's why we use a PHI classification system, right, to help prioritize our protective measures based on sensitivity. So level 1, highly sensitive PHI. This would include things like mental health diagnoses, detailed treatment plans, crisis intervention notes, substance abuse records, also psychotherapy notes, which, remember, have separate enhanced protection under ACA B.3.F and suicide risk assessments. For telemental health, these absolutely require extra encryption, really limited platform access, maybe enhanced authentication, top-level security.
Precisely. Then there's level 2, standard PHI. This covers things like appointment scheduling, basic insurance and billing data, general health info, client contact information when it's linked to health services. Here, standard HIPAA-compliant platforms and regular encryption are generally key. Good basic hygiene.
And finally, level 3, administrative PHI. This includes things like an accounting of disclosures, consent forms, communications with your business associates.
Right. For these, secure email and encrypted file sharing are typically sufficient. Still protected, but maybe not needing the highest level of lockdown as level 1. And applying that minimum necessary standard in your actual telemental health communications is just critical day to day. For clinical documentation, include only information essential for treatment decisions. Avoid excessive detail in session summaries you might share electronically. If you're consulting on a case, use de-identified examples whenever you possibly can. In platform communications, limit those chat functions strictly to logistics, appointment times, tech issues, not clinical content, email follow-up. Only use secure, EA-compliant systems. And text messaging. Generally avoid it entirely unless the platform is specifically verified as EPA compliant for client communication. Big caveat there.
Right.
And when you're sharing info with a supervisor or consultant, share the absolute minimum necessary for guidance, as per NBCC 92. De-identify when possible for case consultation. And always document the purpose and scope of the information you shared. Keep that record.
And there are specific ways to de-identify information too, right? Like the Safe Harbor Method checklist. That involves removing all 18 HIPAA identifiers, replacing names with codes, removing specific geographic info and dates, deleting device-specific info, removing any unique characteristics. It's quite thorough.
It is. And there's also the expert determination method, which usually involves engaging a qualified statistician for more complex data sets, and you'd need to document the methodology used. Probably less common for solo practitioners, but it exists. But for quick decisions, day-to-day, you can use this quick decision tree. First, does this information relate to health, healthcare provision, or payment? If no, probably not PHI. If yes, go to step 2. Second, could it identify a specific individual? If no, it might be de-identified. If yes, go to step 3. Third, is it maintained or transmitted by you, a covered entity? If no, maybe not covered PHI in this context. If yes, then ding, 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 this is PHI. Apply full protections.
Simple enough.
And the key takeaway. When in doubt, always err on the side of greater protection. Assume it's PHI and treat it accordingly. And document your decision-making. This shows good faith effort, protects your clients, protects you.
It's so easy to make mistakes with PHI, though, isn't it? Especially in telemental health, often just because we're trying to be efficient or we're in a hurry. Common ones I can think of. Using client names and file names you store in the cloud. Sending session recordings via unencrypted email. Yikes. Sharing your screen, maybe, and having other client information visible in the background accidentally. Using personal devices without proper safeguards. Or just storing client info in unsecured note-taking apps. I can hear myself thinking, oh, just a quick note here, and then realizing, wait.
Exactly. And those quick notes can turn into big problems really fast. The corresponding best practices are pretty clear and directly address those common mistakes. Use anonymous file naming conventions, codes, client IDs, whatever, to protect identity. Employ HIPAA-compliant file sharing systems only. Prepare a clean digital workspace before you share your screen so no unexpected windows pop up with sensitive info. Implement robust device security protocols on all your devices, work and personal, if they ever touch PHI. And utilize only approved, vetted platforms for all client-related communications and data storage. Stick to the plan.
Okay, this raises an important question, though. We've talked a lot about HIPAA, pronounced APPA, but how does the HITECH Act expand on it? And what about the ongoing challenge of compliance in this constantly evolving tech landscape?
Great point. The HIPAA Act really did fundamentally transform the regulatory landscape in a few key ways. It extended direct liability to business associates. That means those third-party services you use, your EHR provider, your video platform, maybe even your secure email service. They are now directly responsible under HIPAA too.
So it's not just on the practitioner anymore.
Exactly. And that's why business associate agreements, those BAAs, with all your platforms and services are absolutely critical. They spell out responsibilities and manage that shared liability. Make sure you have them and understand them. HITECH also mandated specific breach notification procedures. If there's a breach of unsecured PHI, you generally have to notify affected individuals, HHS, and sometimes the media. Now, assessing whether a breach poses only a slight risk of harm can be subjective. But given how sensitive mental health information is, well, telemental health providers should generally err on the side of notification rather than trying to argue it's low risk. It's almost always better to be transparent and follow the process. Avoids bigger headaches later.
That makes sense. And what about Paratech's meaningful use provisions? How have they impacted telehealth?
Right. Meaningful use, which is now more often part of broader quality payment programs, has definitely expanded to encompass telehealth applications. Practically, for a solo practitioner, this means ensuring the telehealth technology you choose isn't just compliant on paper. It should actively help improve client safety, enhance client engagement, and facilitate secure information sharing. Ultimately, it's about using the tech meaningfully to elevate the quality of care you provide, not just ticking a box.
Okay, and beyond the administrative side, you also mentioned technical safeguards earlier. What does that involve?
Yes. Technical safeguards are the technology controls implemented to protect ePHI and control access to it. A crucial element here is encryption. Encryption for both data in transit while it's moving across networks, like during a video call, and data at rest when it's stored.
In transit and at rest. Can you clarify that a bit?
Sure. In transit is like the secure scramble tunnel your live video call travels through between you and the client. At rest is your client's session notes sitting encrypted on a server somewhere, or even on your local encrypted backup drive. Solo practitioners sometimes forget to ensure their local backups or even their own computer's hard drive encrypts data at rest too. They focus on the cloud platform, but neglect local storage. Both are important. And implementing these technical safeguards directly supports the K-CREP professional practice standards for legal compliance. It's a core requirement.
And of course, we keep coming back to documentation. The requirements for regulatory audits are paramount, right? This includes maintaining digital audit trails, access logs, security incident reports. Essentially, that paper trail or digital trail is your best friend if an audit ever happens.
Absolutely. Your documentation proves your compliance efforts. And underlying all of this, regular security risk assessments really form the foundation of sustainable compliance. These aren't just one-time things. They involve periodically evaluating your technological infrastructure, your workflow processes, even your own competencies, to identify potential vulnerabilities before they become breaches. The goal isn't just to spot weaknesses, but to engage in a continuous improvement cycle. How can we make things safer? How can we strengthen privacy protection and improve therapeutic outcomes? It's ongoing.
And finally, staying current with security. It's clearly an ongoing effort, not a one-and-done task. How do you suggest people do that? Maybe subscribe to platform security updates and newsletters, join professional forums discussing telehealth security, attend webinars on HIPAA and telehealth compliance.
Oh, excellent suggestions.
And maybe connect with other practitioners, share experiences, tips, what works, what doesn't.
Yes, absolutely. Peer support and knowledge sharing are invaluable here. And don't forget a formal annual security review. Set aside time once a year to formally evaluate your current platforms, review your procedures, assess your own training needs, and update your emergency or incident response plan based on the past year's experience or new threats.
Make it a calendar event.
Make it a calendar event. And the key principle to remember through all of this is really start simple and build.
Yeah.
You don't need to implement every single complex control on day one. Focus on the basics first, get those solid. Then gradually add more sophisticated protections as you become more comfortable and knowledgeable. The goal is sustainable compliance, something that protects your clients effectively while still allowing you to focus on providing excellent care. It shouldn't paralyze your practice, and again, when in doubt, always err on the side of greater protection. Document your reasoning. This shows good faith effort toward compliance, even if you make an occasional misstep along the way, because this isn't a set it and forget it task. The rapid evolution of, high-tech telehealth technologies, looking ahead to things like AI and quantum computing potentially impacting encryption, it means our approach has to be constantly adaptive. We're always learning, always strengthening. It's part of being a responsible digital practitioner today.
That's a really important perspective. Okay, as we wrap up this deep dive, let's transition to some reflection.
Absolutely. As you think about today's deep dive, maybe consider these questions for your own practice. 1, how might the principles of administrative safeguards, particularly thinking about your unique role as security officer, show up in your current work or your specific role as a telemental health practitioner? Where do you see it impacting your day-to-day? And 2, what, if anything, might you want to approach differently regarding your security practices and your management of PHI moving forward based on what we've unpacked today? Is there one small change you could start with?